So today we're going to be going through the Edermastamp microneedling program, and it is the theory for CIT, which is collagen induction theory. We're going to be going through hair growth, pigmentation treatments, etc. Just before we start, I would just like to sort of go over a little bit of the history of microneedling. The device that we're going to be talking about today is the Edermastamp, and that particular device was developed by a company called Dermaroller, and that company is in Germany. My cat. Dermaroller was, there's a lot of confusion in the market regarding the name Dermaroller. A lot of people think it just has something to do with roller, but it was actually the manufacturer, sort of like Skidoo. Everybody calls sleds Skidoos or Kleenex, you know, if they're asking for a tissue. Dermaroller was actually the founding company that invented microneedling for skin. And this was done in Germany. And what they were trying to do at the time was develop a method of reconstituting scar tissue, which is collagen 2 and 3, parallel bar formation collagen, which I'll get into further into the course. But they were trying to reconstitute scar tissue into, oh, sorry. Sorry about that. It reconstitutes scar tissue into collagen type 1, and collagen type 1 is that nice mesh collagen that we were born with. It has elasticity, it's like baby skin. So what they discovered and what they came up with is originally it was in a burn unit. So back in the day, the way to deal with scar tissue was they would literally laser it off, and then it would develop into a nice smooth sort of plasticized looking skin. And what it was just even scar tissue. So they didn't want to treat scar tissue by converting it into just another form of scar tissue. So in order to create or reconstitute scar tissue into collagen type 1, what they had to do was create what they call an atraumatic wound. An atraumatic wound, obviously by its name, means no trauma. And they found if they take really precise needles, much like suture needles, and they would enter it into the skin, they'd break down all the adhesions and all the crisscross fibers of scar tissue. They would break it down in a very even pattern, but because there's no real wound, if you can visualize a paper cut, microscopic paper cut, you can have a paper cut on your finger and you really don't see a scar because the skin's collapsed on itself, very little blood, even though it's very deep. And you don't need a scar because the skin sort of coagulated onto itself. There was no rip and tear for the body to heal. So it just coagulates and it's closed and the body's satisfied with that. And you start to produce collagen type 1. So they sort of broke down all of the scar tissue using atraumatic wounds. And at that time, they were actually using a roller, thus the name Dermaroller. And of course, the treatment evolved from the 1990s to what we have today, the Edermastamp. And I think this is probably like the second generation, possibly third generation of the stamp. What they had before was a modality that was very similar to Edermastamp, but it was a little bit more difficult to operate. So as the treatment progressed, they evolved the technology as well. So now it goes perpendicular into the skin, and it is very rapid. We do not use batteries because in order to create an atraumatic wound, you do not want to have pull. If you're having pull with the needles, like a lot of cluster batteries, like you'll see people bleeding profusely from microneedling, and that's because they're causing microfissures, which is wounds, which needs scar tissue to be produced to close those wounds. So the Dermaroller is made a very specific way. It looks a lot less aggressive than a lot of other microneedlings you've probably seen on Instagram, but the reality is that is how true microneedling is supposed to be performed. So I'm going to get into the treatment now, and just to also reiterate, originally it was for scarring, but they found that all the skin around the scar that they were treating was significantly improved. So of course, offering it for anti-aging and seeing all the health benefits of microneedling, they started to develop it for you know, regular anti-aging, and thus became microneedling. And of course, there's been, you know, hundreds and probably 1,000 different knockoffs of it since then, but they are the original. Most of the peer reviews on NCBI, which is a great resource for anybody that's looking into studies. Most of the resources there were done by Dr. Horst Liebel, which was the founder of the company, and his stepchildren, Michael and Alexandria. Michael's the president of the company. They're running it today. And Alexandra, she has her PhD in microbiology. She comes up with all the protocols and products. So they're very rooted in microneedling and have been for the last 30 years or so. So there's many clinical indications for microneedling. However, we're going to be talking about the main clinical indications today, how it works, healing process, safe versus safe, parameters, underlying mechanisms, protocols, and contraindications. Very important to understand. I know all of you are skincare professionals, but it's very important for you to understand the layers of the skin and what we're actually treating, because we do use the microneedling at a variety of depths. So the epidermis is basically 0.1 millimeter to 0.12 millimeter on average. When you're using, we have a home roller, which is 0.2. When you're using a home roller, you should not see blood because it's just going through the epidermis and just touching on the papillary layer to allow a really great product infusion. When you're using, when you're doing like a cystic acne scarring, for instance, you can see the dermis is around 1.5 depth. When you're doing that kind of, can someone mute themselves, please, because I'm hearing echo. If someone's doing a deeper scar revision, they should be going probably 1 to 1.5 on the cheek, because that's where a lot of the scarring is in the reticular dermis. For most anti-aging treatments, or if you're doing a pigment treatment, the papillary layer is quite shallow, and it's the layer that really is the one that ages the fastest. It's most exposed to UV. And a lot of the, like that's where your melanocytes are, etc. So a lot of people are really, if they have a pigment treatment, they really want to be aggressive and they're going very deep. The reality is going deep on a pigment treatment isn't necessary. In fact, it can be over irritating if the people have pigment issues to begin with. So you're typically treating to the depth that is necessary and not more. So if you're doing a pigment treatment, you're going very shallow because that's where melanocytes are. If you're doing a cystic acne scar revision, you're going deeper because it's in the reticular dermis, so you're going to be going deeper than that. When you see a microneedling system and it's like 2 millimeters, or I'm going to go 3 millimeters, it's kind of nonsense, because that's going into actually the fat layer of the tissue, the adipose tissue. If it's on the belly, or if it's on the face, it's you know, into the deeper fat layer. It really doesn't do anything. A lot of times with cluster tips, because when you have so many needles, they don't penetrate properly. So they'll set them at 2 or 2.5, but the reality is there's so many needles, it's only going into less than 1.5 anyway, and that's why they're geared that deep. But typically for any of the treatments, 1.5 is more than you need, because that's the bottom of the reticular dermis. Let me see here. So these are the main indications for treatments. You are going to use microneedling for anti-aging, which we'll get into, scars, stretch marks, pigmentation, and hair growth. I'm just going to if someone can, oh, here, I'm just going to mute you. How microneedling works. First, you do the treatment, you have the healing process, which so fibroblasts, oxygen growth promoting properties invade the area, and then new collagen and elastin is formed. Very important to understand that this does not happen overnight. You have some edema that happens, obviously, because of the trauma to the tissue. And you have this healing process start, but this per scar revision, and collagen type 1 is a very slow growing collagen. And so your skin continues to improve, specifically for scar or stretch marks, for up to 12 months after treatment. So it's kind of like watching grass grow. So again, we're doing an atraumatic wound, which is going to instigate some biochemical response in the tissue, but the actual fallout from that treatment is going to last for months and months and months. So please inform your clients that yes, you're going to see a fairly fast improvement. Usually within the month, they see some type of improvement, but you're going to be building on that treatment, and the treatment is going to continue for a long period of time. I always laugh because sometimes people have a treatment and 3 months later they buy something on the shopping channel and they go, oh, look at how wonderful this cream is. And the reality is it's the treatment that they had 3 months ago that's just kicking in. So it's very important to educate your client to understand that. So again, we're using atraumatic needles, and we create more than 1 million healing centers in the tissue. And how deep do you need to penetrate, or what needle depth you need to use? Only as much as pinpoint bleeding, only until you see pinpoint bleeding, which really looks like a red pore. Again, it's very similar to a micro paper cut or something like this. It's the atraumatic needles are the same as suture needles. They're ground to a 360 degree and almost infinite point. And so it's sort of pushing the tissues apart, and it's going in at the tissue at 150 strokes per second. So incredibly fast, going in perpendicular as well. And so because it's going so quick, it's in and out of the skin. Even though you're moving the handpiece, it's in and out of the skin, and it's not creating the same kind of pull as you would with a slower battery operated cluster tip. You can imagine you're causing microfissures everywhere. So this here, in and out, the skin closes, and you really see a red dot. And lots of times that only lasts for like a few, maybe a few seconds, and it doesn't take place right away. So because it coagulates. So you really aren't seeing a profuse amount of blood. However, if you're treating someone that has scar tissue, because you're breaking down those misaligned tissues, all of a sudden you'll see blood. So if you're doing a forehead and they had a little bit of a scar from their childhood or something, all of a sudden you're going to have blood in that whole line. The whole outline of the scar is going to look red with blood. That is absolutely normal. Absolutely normal. No reason that you're breaking down the scar, and what's going to happen is that scar is going to heal. And because it's a very even method of traumatizing or breaking down the scar, it's going to heal much more even. And that's a wonderful thing. But with the blood that they're secreting, I turn off my foot switch. That handpiece is run by a foot switch. You turn it off, and you just use the tip of your handpiece to blend that in with your hyaluron that's already on the skin. And we're just using that almost as a lubricant as well. So we're adding their own keratinized plasma in with the hyaluronic acid. So it just looks like pink hyaluron. Don't let the blood just sit there. Don't wipe it off. Use it, but blend it in, because I don't want any scabbing, or I don't want any of that to congeal, because it will. And so just blend it in until it's not bleeding anymore. So that is how the only visible indication when you see a significant amount of pinpointing. It should not look like that. It should like that. And even that's fairly aggressive treatment. So the healing process is controlled damage that allows the wounds to heal slowly and correctly rather than emergency mode. Cells that specialize in wound healing become active, migrate to the site of wounds, and proliferate. Punctured capillaries bring blood platelets, immune cells, endothelial cells that release growth factors and cytokines, which increase cellular signaling and amplify the healing response. You end up with cellular communication is improved, cellular functions are improved, damaged skin is replaced with new skin that has improved structure and elasticity. Every time you see that purple sort of hashtag, the basket weave collagen, it symbolizes collagen type 1. I always say collagen type 1 is like linen, and if you cut it and stitch it up with thread, that is collagen 2 and 3. Collagen 2 and 3 doesn't care which pattern it forms, as long as it's pulling that tissue together and tightening it up and closing it to protect the body from infection. So, and collagen 2 and 3, the parallel bar formation grows really, really fast. Collagen 1, the basket weave goes grows very slow. So it's very important to know that it's not just collagen inducement, it is what kind of collagen do you want to induce. It's very important. The cellular communication is the key. You release cytokines and your T killer cells, everything, because your skin's been compromised, your whole immune system goes crazy and everything is activated. Well, your cytokines are the cell communicators of your skin. And so when you have a flush of cytokines to the area, what happens is all of a sudden your melanocytes gets the right cell communication and says, stop overproducing. This is how much melanin you're supposed to be producing. Your sebum gets the right communicate, and it stops overproducing sebum. So all of a sudden, all your cells are regulated because the cytokine levels are improved. So it's much different way of treating hyperpigmentation than, let's say, your traditional phototherapy or IPL or something like this, causes coagulation and your immune system breaks it down. What's coagulated, this here is actually treating the signals and actually normalizing the cell function, which is huge, huge, huge when it comes to anti-aging or any kind of skin remedy for the tissue. Let me see here. So this here is the body's natural wound healing process. You have a blood coagulation, then vascular response, inflammation, get that edema. Then you start to form collagen, reepithelialization, your skin starts to produce new skin, and eventually contraction, and that happens over a longer period of time. I'm not going to get into this. This here is, there's so many products on the market for microneedling that it's mind-boggling. And ours is an atraumatic needle, and you can see why it's an atraumatic needle. It's made by the same company that produces suture needles. The only thing that's different between our needle and someone that's using it in a surgical procedure is ours are non-polished, because we want a little bit of irritation in that. And the suture needles are polished. Most of the, like, you'll see home rollers out there and rollers for at-home use at 0.5, 0.1, which are really technically illegal, both Health Canada and FDA. There's nobody that's actually ever regulated them or approved them for anything. They're so dangerous for your skin, you have no idea. But sometimes you'll see a roller and there's a line in it, and it's because it's almost like a star. They have like these metal sheets in there, and it's very easy. Instead of going through, like, our needles are 8 processes to grind it down that small. These ones are like sheet metal, cut really thin and made to really severe points. So you're literally rolling knives over your skin. So if someone uses something like that, like, don't even bother, because you're actually doing the opposite. You're converting your healthy collagen type 1 to collagen 2 and 3. You're causing micro scars all over your face when you're using those kind of needles. And you might not see the results right away, but when you're older, all of a sudden your skin looks really granular and irregular pattern. And because of the type of wound that you're creating, you have much higher risk for issues like granulomas or cellulitis and things like this. You can end up having a lot of complications from using them. So it's a huge difference between how our needles are made and the needles that are out there. And please, like, if you're using Dr. Pen, just stop it, because you're actually ruining people's skin. You're going to have edema and some nice swelling at the beginning, so they like nice and smooth, but years down the road, they're going to be paying for it, because you're creating misaligned collagen all over their skin. This is also another reason why it's very important to have an ISO medical quality product. Ours is audited, means that people are like, there's government bodies that come in. We have a very specific ISO and we have a very specific CE. They come in, they look at our products, they ensure that everything is sterile and everything is manufactured properly. And if there's any kind of issue, we have to issue a callback, which is a very expensive procedure for us. So we're government regulated, and that is why, who wants to have like a fish hook stuck in, microscopic fish hook into their skin all over the place? And a lot of times you'll see people on Instagram and they'll have repeat bleeding dots here and there all over their face when they're doing it. It's because they're using either a cheap pen or a cheap roller and they're doing this to their face. It's very, very bad, and it is causing damage to their tissue. This here is the difference between a wound type. This is atraumatic versus disc or cluster tip drag. So if you're using an atraumatic wound, the needle goes in and out really super quick. It breaks down the scar and it retracts, allowing the skin to close. So you do not have the same amount of bleeding as you would with someone with drag. The disc needles are literally slicing. Those end of the blades are creating pressure, so it sort of pushes the skin in and slices through it. It causes that, which causes long-term skin damage and micro scars everywhere. So there's a huge difference between an atraumatic wound and a traumatic wound. This is what happens to a traumatic wound. You get a blood clot, and then there you can see the collagen going parallel bar formation collagen, closing that wound. So you're going to have a scar tissue there. It's going to be like a little pore of scar. That's exactly what it's going to look like. This is why we only use 6 needles is, it's derma roller. They've done a gazillion studies, tons of peer reviews on our products. And they found the more needles that you have, number one, the needles have to be thicker to withstand the pressure on the tissue, and it causes tissue compression. So it's just like this gentleman here, this guru lying on the nail bed. He can lie on that, nothing's going to enter him because there's pressure on the tissue is evenly dispersed right across his body. When you're having like a cluster tip 12, there's some devices out there that use 36 needles. All it's doing is pushing this tissue down, and then it sort of pops through the tissue, causing unwanted trauma to the skin. So in microneedling, less is more. And they'll say, well, we have good coverage because we have 36 needles or 12 needles or whatever. The reality is 6 needles at 150 insertions per second. Who cares, right? You're still going to have 1 million punctures on the skin, and probably the number of punctures, because our machines are significantly faster than everybody else's, is going to be the same or greater even, and we're not going to be causing that drag and the pressure on the tissue, which is going to cause unwanted damage. This here is a microscope look at tissue that has been used with a cluster tip. You can see how it's punctured and pulled all over the place, and that is going to have an irregular healing process. So here is the recipe for good microneedling. It's incredibly fast, so it doesn't have the pull and an atraumatic wound. I'm not going to get into that. This is very important too. So when we're using microneedling, we have to have something with either sterilization or very low, what they consider low bacteria load. Low bacteria load is a product that came with created in a sterile environment with sterile products. It's not sterilized after it's produced, because if you sterilize it like growth factors, you'll kill the growth factors. So what they call it is low bacteria load, and that is created in a lab, basically. That's like our Ready Medical. It's considered sterilized, but you can't sanitize growth factors, okay? Syringes and everything else have to be sterilized. When you disinfect, you still have a significant amount of microbes, and most of them are eliminated, but not all of them are eliminated. And when you're using a regular product, like there's so many people with pumped hyaluronic acid because it's cheap. And the reality is it's not even about the bacterial load, which you can see the load is 10 to the second. So it's a significant amount of microbes in it. But in something that is sanitized, like a regular cosmetic product, you have the germicides like phenoxyethanol, you have preservatives, you have filler, you have all kinds, you even have fragrance in it in commercial used products. And there's so many people on the market right now with microneedling, and they'll say, oh, I really like this product, I'm going to needle it into my skin. And there's products out there in rollers, like they have little roller balls in the end, and they're needling this into the skin. A roller ball is going to be picking up microbes from all over your face, and you're going to be needling all of that into the skin. So you should be really careful on what you're needling in. I know there's a lot of really nice name brands out there, and they're saying needle our products, it's safe. Most of them I've read through their studies, and their studies are really pitiful if you actually know how, like if you're actually familiar with the background. And they should not be needling, especially something that's eyedropper. Something that's eyedropper has to have a significant amount of antifungal properties because it's exposed to air all the time. And I know of very nice clinics that are using eyedropper products. It's been used on 10 different, 20 different people, and they're using that for microneedling. You should not do that because you're going to end up with significant irritations with the skin, and it does not necessarily present right away. A lot of times, and I'm going to get it, like, because we're instigating an immunity response, when you're needling in something that has, even a safe germicide or even a safe filler, I'm talking about the product that fills, like, it causes viscosity in skincare. When you needle that into the skin, your immune system is going to attack it, right? It's looking for anything foreign, and it's going to, because the skin knows it's been compromised, and it wants to fight. It wants to fight off anything that's foreign. So if you're putting in something like this, it might not present right all of a sudden. It is going to blow up on their skin. It could be a week. Sometimes it's slow going, and you end up with granulomas because there's particulates in the tissue that's deep into the dermis that you've allowed because of microneedling, and your immune system starts to attack it. And the only way to deal with that is adding steroids to the area to reduce your immunity response. So it's like there's so much. I've talked to so many people and had so many people. I had a poor girl from the States contact me, and she was treated at a medical location with a very well-known 36-pin needlings, and her skin is a mess. And this is months after, and they're saying, no, it's not microneedling. It happened 2 weeks later. I'm sorry, but your immune system is still responding to products for a long time after. And a long time granulomas don't present till actually maybe the second and third treatment in. So please do not use commercial product for microneedling. You can end up ruining somebody's face. The Edermastamps, 150 insertions per second, which is basically the fastest machine on the market. It's smooth and quiet, consistent power, precise penetration. And if I'm doing like 10 treatments at once, there's no, the first treatment is going to be 150 strokes per second. The last treatment is going to be 150 strokes per second. So it's very, very important to have an electrical device, and especially if I'm doing someone that has a gentleman that has thick scarring, what's going to happen, it's going to take a lot more pressure, it's going to take a lot more power from your stamp to penetrate that skin evenly than someone that had very fine skin. So it's very important to have the consistency, irrelevant to what type of skin you're treating. So the module itself has a little reservoir here. So if you're using, we have a pigment treatment, and if you're using this particular cartridge, you can take a syringe and syringe it out of the ampule and put it in that and infuse it into the skin. And it is sterile, and it's not just, they don't just print sterile on it, it's actually audited sterile. And it's a medical quality audited product. So we're going to get into now does anybody have any questions before I continue? No? Okay, I'm going to continue. Microneedling main mechanisms of action is neocollagenesis, keratinization, angiogenesis, and melanogenesis. Neocollagenesis is the production of new collagen. Microneedling triggers a rapid differentiations of fibroblast cells and increases the production of collagen, elastin, and GAGs. And it's also referred to as percutaneous collagen induction. You'll see here, there's Horst Liebel, and wrote the journal, in the journal, one of his peer reviews on microneedling. He was one of the founders of Dermaroller, just FYI. Oh, here is on the picture itself, you'll see the controlled biopsy, and in the study, you'll see the collagen is stained purple. So you can see significant amount of new collagen produced 6 weeks later. And if you're looking at the needle depth, that is probably at about a 0.6. So that treatment was right into the top layer of skin. It barely made it into the reticular, if at all. And you can see all the new collagen. So again, sometimes less is more. You're still going to have a really, if you're worried about, oh, I'm kind of nervous and I'm only going to do a treatment of 0.6 because I really don't want to go that deep. Guess what? You're still going to have a really significant amount of collagen. You're still going to be making a big impact on their tissue, even if you're going slow, even if you're going shallow. So I wouldn't be too concerned about, oh, I need depth, I need blood, because you don't. Most anti-aging treatments are actually done shallow. Keratinization is a natural maturing of keratinocytes, which migrate upwards, squeeze, flatten, and die and flake off. It declines with age. Proper keratinization is necessary for the integrity of the physical barrier. Clinically proven microneedling normalizes keratinization. And it's very important, especially for aged skin, that they have that skin barrier restored, and especially for sensitive skin. Like, a lot of people think sensitive skin, they can't do microneedling. And guess what? If you're doing a nice shallow treatment on someone with sensitive skin, all of a sudden their skin isn't going to be so sensitive because their resurfacing has been restored and their skin's going to thicken up. So all of a sudden there's a huge improvement in their tissue. So again, you have a greater variety of skin conditions that you can treat with this than you would be with laser or anything else more aggressive. Melanogenesis, the process which melanocytes produce melanin. Pigmentation is the result of excessive melanin production and uneven distribution. Microneedling leads to rapid normalization of cell-to-cell communication. Medically improved microneedling normalizes melanogenesis. Optimal results are achieved by combining the infusion of anti-melanogenic ingredients. So we do have a product, and it's called Accelerus Pigment. And we use it to lighten and brighten, and it's great for restoring even tone in the tissue. However, where the melanocytes are, just to let you know, where the melanocytes are is super shallow. So a lot of times when we're doing a melanin correction with the treatments, we're doing microneedling, but you're going to be infusing that product really super shallow. We do not want to see blood when you're doing a melanin correction. You're going to be taking your Accelerus product and just dropping a drop here and there, and you're going to be working it in with your needling, and you might be only doing 0.3 in the forehead, maybe 0.4 in the cheek. Very, very shallow. No blood is necessary because we're just infusing this product where your melanocytes are. Now, the benefit of this over a lot of peels, for instance, is you would need a really aggressive peel with a low pH to really help get that product where it needs to be. And the risk of that is you can always have excessive blanching, etc. When you're doing needling with melano corrective product, you're actually just you're needling the product exactly where it needs to be without the risk of a low pH. So excellent, excellent treatment for discoloration. And I have to say, just doing the treatment all by itself, even without with an extra product, just with hyaluronic acid, you're still going to see color correction. I'm going to be talking, someone just asked me, how do I combine treatments like with microneedling as laser and oxygenation and peels? And I'm going to be getting into that in a little bit. As soon as I'm done the indication, the portion where I'm doing here. Okay. Hang on a second here. So angiogenesis is a huge part of microneedling. If you can look in the bottom diagram, you're going to see the capillary, and it was damaged with the microneedling, and all of a sudden the VEGF, which is the vascular endothelial growth factor, invades the area, and it starts to produce more tributaries. And I'm always liking it to like when you trim a plant, you know, you have a tree and it's really poor quality and there's a few big branches and that's it, and you trim it and all of a sudden it has new growth everywhere. It's the same thing that's happening here, except it's vascular. And why is that important? When you have someone that's aged and you have these dilated capillaries, there's a reason why it's dilated, is because all these small tributaries of blood vessels have collapsed. And so it's leaving all the blood sort of pool, and it damages the other vascular network in the tissue. So what happens when you're doing microneedling, you get in VEGF invades the area. All of a sudden, they have new blood pathways everywhere, and it takes the stress off the major capillaries, so they don't dilate as much. And you end up with nice, rosy looking, beautiful skin. And lots of times with aged skin, they have quite shallow skin and very little color, but you can see the dilated capillaries, and it doesn't look very nice. It looks very aged. It looks waxy almost, because the skin itself doesn't have that blood network to deliver nutrients and oxygen to the cells. So this is a huge part of an anti-aging program. If you're starting young and you're working all the way, like you're doing microneedling on a regular basis, like annually from 40 to like 60, your skin at 60 would look like decades younger than the average person that didn't have microneedling. It's probably one of the only other treatment out there that creates angiogenesis like this. And that's a huge part, like delivering. You can put all the product you want on the skin, but unless you have a blood network that is bringing that oxygen and everything to the tissue, it's almost for naught. So very, very important. And specifically for stretch marks, you have these tears in the dermis, and there's no vascular network in there at all. And so you have the white stretch marks. When you're doing these types of treatments, you'll have pinpoint bleeding around the stretch mark. And then you will see how maybe second treatment, third treatment in, all of a sudden you start pinpointing inside the stretch mark itself. And it's because you've instigated the VEGF, and all of a sudden blood pathways are going into the stretch mark and bringing back color and life into that area. So it's and tightening the skin, which makes the stretch mark look less. So it's very, very important process for treatments. For hair growth, it's imperative because it's the VEGF. Even with PRP, for instance, the main part of PRP is VEGF. Well, guess what? You can have it even without the PRP. You're getting VEGF and that network of new blood vessels, even without PRP, just doing the treatment itself. So very, very important portion of the treatment. Now, I was just asked a few minutes ago about how we incorporate IPL and microneedling and oxygenation, etc. Just thinking about VEGF and thinking about IPL being a coagulator of blood vessels, I would never do IPL after microneedling because I don't want to coagulate what I'm creating. So normally with any of these treatments, I'm always doing my exfoliation, like with the oxygenate, for instance, to oxygenate and prep the skin and thin all that dead epithelial off. And then I am doing my phototherapy to coagulate any excess melanin and to coagulate any excess blood vessels that have been damaged and get rid of them. And then I'm going into my microneedling, and microneedling is going to normalize all of that cell function, which is going to maintain. Lots of times with IPL, you can get rid of discoloration, you can get rid of blood vessels, but you end up having that kickback as soon as you're back in the sun. If you're normalizing the cell signaling with microneedling and you're infusing their microneedling corrective product for that particular type of skin ailment, you're going to end up with not only increased and significantly better results, but also you're going to maintain those results for a significantly longer period of time. So you're going to, if someone's coming in with very cuperose skin, you would coagulate it with phototherapy. And then after you're done your series of phototherapy, then you're going to come in with your microneedling, and that's going to create all new blood pathways that aren't collapsed, that are healthy, and it's going to have a nice network so nothing gets dilated for a long period of time. And that's going to be your maintenance plan, actually, is to do microneedling on a regular basis. You know, if someone has a tendency to have more cuperose skin, it almost seems like a oxymoron to do microneedling because it makes you red, right? But it is not. It's actually great for cuperose skin, provided you've already treated them with the IPL first. Someone asked if you can treat melasma. Yes, you can treat melasma. Like melasma, though, you always have, because we're talking to estheticians here, and I'm not sure if you're working with a medical location or not. And I will get to those other, like the Botox and fillers and everything else when we're getting to that portion of the program, but it will treat melasma, but you have to always understand where the melasma came from. As estheticians, you're not really supposed to be treating medical conditions unless it's, we're not endotheliologists, so we have no idea of what was the root cause of the discoloration. So it's important to have an understanding where it came from before you treat. So microneedling and growth factors. Growth factors are the driving force behind the healing process. Our cells produce growth factors and use them for communication. As we age, the secretion of growth factors decline, and which impair wound healing. Microneedling triggers the release of specific growth factors that promote wound healing and increase cellular activity. This is very important when you're doing microneedling. One of the biggest portions of it is we're triggering those growth factors, specifically TGFB3. TGFB3 is the main, does it go into the next slide? TGFB3 is the main growth factor that produces the mesh-like collagen. It is significant. It's 3 times more than other growth factors. It plays a role in dermal remodeling, helps fibroblasts and keratocytes. It's shown to increase the collagen of type 1, which is exactly what we're looking for. TGFB3 reduces TGFB1 and TGFB2 that's associated more with scar formation. And I'm bringing this into PRP, because everybody asked me about PRP and microneedling, or if I should just do microneedling. PRP is a fabulous treatment, and it was used, originally it was used to heal joints, tendons, things like this. They found that, especially with athletes, they would take their blood, spin it, put the plasma in their wounds, and all of a sudden their wound would heal significantly faster. And then, of course, they started applying it for all purposes, including the skin. The reality is when you're using plasma from an arm versus plasma from a wound, the growth factors are significantly different. When you're taking it from the arm, you have TGFB1 and TGFB2. Well, that's more associated with scar formation, and that produces rapid healing. And that's what TGFB1 and TGFB2 does. It helps heal us significantly fast, but we don't necessarily want to be healed fast if we're using an atraumatic needle, right? So if I was using some kind of coarse needle that was causing microfissures, yes, TGFB1 and TGFB2 is really helpful because it's going to help me close the skin and heal really quick, and they're going to, reduce any risk, etc. If I'm doing tendon relief, if you can visualize a tendon, the tissue, what does it look like? It looks all linear, right? So the tendon itself and all of the joint collagen is made up of TGFB1 and TGFB2 and TGFB3. It's all parallel bar formation because it's a joint and it needs that elastic and it needs that strength of it's technically scar tissue, but it's the same kind of collagen that makes up scar tissue. So TGFB1 and 2 is really critical for wound healing of joints because they need collagen 2 and 3 for the joints. If I'm just doing an anti-aging program, I'm probably not going to want the TGFB1 and TGFB2 to be prominent, to be honest with you. So I would prefer just doing microneedling on its own. However, again, if you're doing someone that has cystic acne and you can't do a microneedling on them, what you could do is use a gun with TGF, like with PRP, and that's going to really help heal the wounding of the tissue and the inflammation because it produces fast wound healing. So there is place in dermal programs for the PRP, but if you're just doing a regular anti-aging program, I probably wouldn't suggest it. I would just do regular microneedling and you're going to have a better result. It's going to be less expensive for your client. You don't need the rapid healing of PRP because we're using an atraumatic needle to begin with. We're not causing microfissures. So it's really not necessary. So again, I'd rather do 3 microneedling treatments and have a really nice long-term result than one PRP, which is going to go on meh results, on the skin. How for infusion, when we do microneedling at home, it's been clinically proven. So we do a lot of retail for home rollers, and a lot of your clients that are coming in for microneedling, they should be using the home roller for long-term benefits. And when you're doing the home roller at 0.2, you end up with 80% better absorption of active ingredients. So it's very, very important to understand that when you're using a home roller, it doesn't replace the regular microneedling, but it does help super absorb the products that you're giving them. So a lot of times when we're doing a microneedling, a professional microneedling, we're suggesting that they use the home roller in between treatments, because the microneedling professional treatments are done every 6 weeks. So you can use the home roller to really add, like probably about 10 days after treatment, or 7 days after treatment, you can start rolling their skin, and that's going to help with the added product absorption, and it's really going to boost the collagen results and the collagen enhancement of your treatment. And it's specifically important. You wouldn't wait that long for hair growth, for instance, but when we're doing hair growth treatment, we're doing a professional treatment, and probably 2 or 3 days later, we're actually using the home roller to get that 80% absorption, to get that DHT blocker in the skin and amplify the hair growth. This here is an efficacy comparison. The first is no treatment. The second treatment is if you gave a nice facial, like a nice regular facial to somebody, you'll see some enhancement of collagen. The purple is always the collagen. The C is the after microneedling treatment. And if you just went through your regular home care or whatever they're normally doing at home. D is you doing microneedling with the appropriate products made for microneedling, which we have. Normally when we're doing microneedling, we're using hyaluronic acid for 48 hours afterwards. We have the hyaluronic acid mask, we have the ampules, hyaluron only, and we do not do any aggressive product on the skin. We want the skin to close. Your immune system is so heightened at that point that even if you're putting like a vitamin C, everybody wants to slather everything over everybody's skin at that point, your skin's going to fight against it. So please don't be adding, your skin's not going to be doing anything effective with anything you're adding immediately anyway, other than something that's calming, like Matrixyl, like the E that we have in the microneedling products. But about 48 hours after, you're going to be going into your product. And we normally, if you're for more sensitive skin, I'm usually recommending the Dermaroller A, C, and E. And it's A, C, and E that was clinically studied to really enhance the effectiveness and the production of collagen. And we have all of that already formulated with you. It's very important not to have a wash after the skin that's has too much emulsifier in it. So we have appropriate washes for the skin afterwards. One's with Dermaroller, one's the Accelerus line. Both are very, very effective. Normally for a basic treatment, someone's young skin, I'd always recommend, or sensitive skin, always recommend the Dermaroller classic line for post-care. And people say, well, when can they go back to their regular program? Their regular program is probably, like, if their products are old, if their products, even if it's 6 months old, our products for microneedling has a diaphragm in it to keep it air free. And also every time they're doing a series of 3, which is 6 weeks apart, I'm always giving them a new moisturizer and a new cleanser, because that moisturizer should last them their 3 treatments. And after that, they have to toss it anyway, because any product is going to get full of bacteria, and you're treating skin that's going to be compromised. So no, they can't be using something they bought 6 months ago and haven't finished yet, because it's probably full of bacteria. The actives in it are probably too high, and probably the amount of preservative is something, and fragrance and everything else in it is too high. So no, they shouldn't be using their regular products, but that product probably has enough preservative life in it that they can do their 3 treatments, use up their ACE, and then go back to their product afterwards. These are the products that we use. We use a syringe product for the CITIL, and that is the hyaluronic acid syringe. And it is micronized. It does not have any preservative, etc. in it. It is a concentrated hyaluronic acid gel. You're putting that a drop by drop on the skin. And I'll be sharing with you all a video of the treatment. The silk mask, and we also, for recovery after, we have a silk mask, soaked with hyaluron, vitamin E, and matrixyl, and it keeps the skin closing. It goes on like a second skin. It keeps the skin airtight, air-free for the 20 minutes. So it allows the skin time to close, so to protect it from the elements of outside. It's adding hydration because your skin's just been perforated for a million punctures, so it's going to dehydrate really quickly. So it's the vitamin E and hyaluronic acid, super important for that. The matrixyl, very important for collagen enhancement. So it intensively supplies the skin with new moisture, promotes collagen elastin, long-lasting substance, starts within 20 minutes. Now, a lot of people, that mask really reduces, I would say, probably 60 to 80% of the redness. So when they go home, they look amazing. And I do not wipe the skin. I don't touch the skin. I microneedle it. I take my tip. If there's any blood, I blend it around like it's sort of like pink hyaluron. I mask it. I'll let all the plasma and hyaluron absorb into the skin. I take the mask, I throw it out. I don't touch their face. I don't put on sunscreen. It's sun avoidance because sunscreen is too occlusive and has too many chemicals in it. And I let them go home like that. There's lots of serum on the bottom of that mask envelope. So I'm always telling them use the serum when I get home. Lots of times I give them the syringe with the little cap so they can syringe the hyaluron out of their envelope and use that as a home care as well. We also have ampules that you're probably going to get a box of 30 ampules. If there's not enough leftovers to last them 48 hours, you're going to give them a couple of the ampules for home care. And we sell those masks like bread because they're so calming. So if someone has sensitive skin, they should buy a mask from you from home care. And that's just part and parcel. We sell tons of masks. Some clients actually buy a whole box of masks for their program. And so they're rolling their skin and putting masks on them at home. So it's a wonderful, wonderful product. And it really isn't that expensive. I think your cost is like $8 something a mask. So the retail of that $20, and you're making good money, but it's well worth it for them for their recovery. It's sort of like an insurance policy for them because sometimes after needling the next day, if they have allergies or if they're easily irritated, they can, get overheated and or sweats or something, their skin gets irritated, they put the mask on and it's gone. So it's really important. It's a really important part of aftercare. Now we have optional ready medical with hyaluronic acid and growth factor syringes, and that's a different product all the time, but this is manufactured in Italy and it is amazing. Remember when we were talking about growth factors a few minutes ago and saying what an important part of it is of the treatment? The reality is once you hit 50, a lot of our fibroblasts have already converted to fibrocytes, even before 50, especially if they're smokers. There's some people that you're going to be doing a treatment on, you're just hitting a wall, there's no response, and it's because a lot of their fibroblasts aren't active anymore. So we have Ready Medical that has 8 different growth factors, and I'm going to go into that in a little bit. And it basically fools Mother Nature. It's adding the growth factor so you don't have to produce it. So you're going to produce more collagen elastin. You're going to heal significantly faster for it because it's just like it's like a young person producing it. It's been clinically proven, and there's tons of studies on this product to be 100% similar to our own growth factors that we produce. So it's the very same when you put TGFB3 from the Ready Medical on your skin, it's the same as I produce TGFB3. So it's a very, very handy tool to have, especially for aged skin, compromised skin, sensitive skin, and this would probably replace your PRP. Again, with aged skin or people, they might not have a good diet or they're on medication or whatever, their PRP, they really don't have anything to offer anyway. So Ready Medical is probably a better choice for them than offering their own plasma. So it's very, very nice, and it's significantly less than PRP for the cost. They should avoid sunscreen for about 2 days, 2 to 3 days. I'm really sensitive to sunscreen. The good news is that the Dermaroller line of products has a CC cream with a 30 SPF. they can use that about 48 hours afterwards. And it's sort of color correction as well. The more you blend it, the more it turns into their skin type. I really like it because it has like copper tripeptide in it, Matrixyl 3000 in it, and it's a moisturizer too. So it's sort of like they can put that on if they're wanting to go outside or something. But for at least 2 days, they should be avoiding even our product. And that says something. Ours is made for needling and compromised skin. Very important for that because again, how we're amplifying the immune system. We don't want any histamine responses. That being said, if someone is prone to allergies or something like this, and they're going outside and they get, pollen or something, and they get hives, always make sure if they're prone to allergies that they have an antihistamine ready that they can pop in, and so that they, hives is probably the most common response to microneedling because it's sort of like almost like an allergy response. When they do an allergy test, they puncture your skin and they apply whatever your allergen might be, and then they wait for response. That's what microneedling kind of responds like sometimes. So it's important that they have an antihistamine. Going back to the treatment, we're going to go into the contraindications, but someone asked about injections. Anytime, because this is going deep into the reticular dermis at times, and it's causing a lot of blood flow, etc., you wouldn't do Botox or filler before these treatments for at least 2 weeks. And I think you'd be fine after that. So the treatment protocol, the best based on best practices, it's 3 treatments 6 weeks apart. Do not put the treatments closer together than 6 weeks if you're going deep, because your skin isn't going to like it. It's going to over respond. It's going to produce the wrong collagen, and you can end up with skin sensitivities from it. So when you see people microneedling every 4 weeks, that is incredibly wrong, unless they're going shallow. If you're using our pigment product, because you're only going maybe 0.3, like maybe 0.4 on the tissue, you can go 4 weeks with that because you're not getting deeper into the dermis. So that's very important. For numbing cream, we're using an anesthetic cream with 5%. We sell the Zenza. It's really inexpensive. It's only 5%. You wash it thoroughly after your treatment, after you've applied it, and then you sanitize the skin with 70% alcohol. But I'm going to be going through the whole treatment guideline with you at the end of this presentation. The downtime after CIT, the treatment will be tender and mild redness and should diminish in a day or 2. This is the chart. You should all get that with your machines anyway. The forehead, we started about 0.3 and we work up in increments of about 0.1 until you see pinpointing. And at pinpointing, it doesn't have to be all over. As long as you're pinpointing here and there enough evenly over the skin, I'm happy with that. It's always about 0.1 millimeter underneath the eye more. And the same with the upper lip and the same with the chin, and you'll get more guidance with that with the video that I'm showing. Normally when I'm doing the treatment, I do the forehead. I'm doing here, can you see my arrow? I'm doing the forehead, underneath the eye, underneath the lip, and then underneath the chin, because those are all the shallow areas. And I do not apply hyaluronic acid to the cheek because I'm going to be grabbing that cheek and pulling it to keep the skin nice and taut during my treatment. So I'm normally doing just nice big circles, loose, and I'm doing it in a linear pattern. So I'm doing nice coverage. I'm not doing one area really, really thorough because that feels like a sewing machine on your head. I want the client nice and comfortable. Plus, I want to give the skin time to respond. So if it's getting too red, like lots of times you don't bleed for like a minute or 2. So if I'm out of the area, it gives that skin time to respond so I can actually see a proper reaction to it. And we'll be going through more of that at the end. And of course, you're hands-on. And these are the 2 lines that we have for skincare. We have the Classic, we have the Accelerus Pro. Accelerus Pro is much, and I'll send you all information on that. That is, if you have somebody that's more anti-aging, it's a cellular technology that's really going to amplify the results. If you have more sensitive skin, if you're younger skin, Even if they have like, because the Accelerus Pro is significantly more expensive, or like more expensive, not significantly. The classic line is very affordable, but it's very gentle. I like it on my skin because I have super sensitive skin. So I often use the classic. There's some Accelerus Pro line that I really, really love as well. And if you're anti-aging, you're going to be using the Accelerus Pro more for an enhancement. Remember, I was telling you, when you're doing the treatments, your skin continues to improve for a long period of time afterwards. They strongly recommend that you use the Accelerus Pro because it was made specifically for that recovery time. The classic has less product in it. It's less actives in it, which if you're more sensitive skin, or if you're doing the treatments more deep, I prefer the classic response. So if I'm doing a deeper CIT on someone that's young and doing acne, I'd probably recommend the classic line. They would just have the cleanser and the ACE. They'd be very good with that. And that's very simple home care that they're going to follow. If they're a smoker, they would do the moisturizer ACE, which is just like it says, it's vitamin A, C, and E. And they would use what they call lipopeptide in the classic line. And it's a night cream, and it has the retinols in it. Most of the retinols in our product are very, very gentle. They're, my mind is blank right now, but they actually convert to retinol after it's absorbed, so it's much easier. But the lipopeptide has a product in it called rutin. And if you go onto the NCBI site, there's a beautiful explanation of rutin. Even if you were just using rutin on itself, you're going to be having collagen enhancement significantly. So they have that in their night cream. So it's very nice. The classic line, more gentle. If someone had more cupro skin, I would use the classic line. If someone was younger skin, I would use the classic line. And affordably factors, it is very reasonably costed product, which we normally just work right into the program actually when we're doing costs. The Accelerus Pro line, one of the products that I want everybody to have actually is the Accelerus CC cream, because it is the 30 SPF, which is fabulous. All of their products has the copper tripeptide. Sorry, I need my tea. The Accelerus Pro has copper tripeptide. It has alpha-brutin in some of the products. It has Matrixyl 3000. It has a lot of different botanicals in it for really to stave off aging. And their cell repair product is awesome for aged skin. So that is something that they can work into their program and use it as a maintenance program for the next 6 months or so afterwards to they can be on it permanently. That's more of a classic long-term skincare program for someone that is really serious about their microneedling. This is the pigment correction. The pigment correction is a treatment that we infuse into the skin. As I said before, you use this very shallow because that's where your melanocytes are. And typically with any microneedling program, because of your heightened immunity, you do not administer anything that has too much product in it deep into the dermis. You're going to get kickback. So any of these treatments like pigment correction, hair growth, you do not look for blood. You're going more shallow, maximum 0.5. With the pigment correction, because I know where melanocytes are, I'm usually 0.3 to 0.4. So you in the kit itself, you get a box of 7 ampules, and it has anti-melanogenetic and antioxidant ingredients. In the lotion, it also comes with a home care and has ACE, which you probably recognize from our moisturizer ACE. And it also has niacinamide, which helps even out your skin tone. The optional for pigmentation that we have is the Ready Medical hyaluronic acid with vitamin C serum, which is a sterile product that you can add that. If someone didn't want to go through a whole kit of pigment correction, they just wanted one treatment for lightening and brightening and a beauty booster, they can use our Ready Medical antioxidant, and that's what you would probably do for them if it was a single treatment. They can, some people really love it and they continue with it anyway. It's the hyaluronic acid in the Ready Medical is micronized with ultrasound. So there's a variety of cellular structure and hyaluronic acid. So there's small, medium, and large molecules in it, and we'll go into that deeper when we go into Ready Medical, but it's a fabulous treatment as well for as a beauty booster. So we're going to get into now this here, just to give you the pigment corrective active ingredients in the bright lotion, which is the home care. We have niacinamide, citric acid, phytic acid, vitamin E, retinol, apricot kernel oil, caprylic, triglyceride, and bisabolol. And in the highlight serum, we have niacinamide, salicylic acid, mandelic acid, phytic acid, hyaluronic acid, licorice root extract, Indian gooseberry extract, and white mulberry goose extract. And that works. I have to say, I've seen some pretty fabulous results for pigment correction with that. So just to go over the programs themselves, the tyrosine inhibitors is white mulberry, licorice extract, Indian gooseberry, salicylic acid, citric acid, retinol, and bisabolol. Now that inhibits the tyrosine, which stimulates the melanin production, and they inhibited the activity of the primary enzyme and melanogenesis, and therefore downregulating the melanin production. Mechanism action is melanin transfer inhibitors, which is the niacinamide and retinol. I think everybody's familiar with those two ingredients. And they hinder the transfer of newly produced melanin into the keratinocyte. So it's not allowing that discoloration to come up to the surface and be more pronounced. Antioxidants, which is very important. This is a fabulous treatment just for anti-aging in general, even if they don't have it, they just want a beauty booster, if they're scared of blood, if there's, just want to sort of put their toes in the water when it comes to microneedling, this is an excellent program for them. And for antioxidants, they have the niacinamide, white mulberry, licorice extract, Indian gooseberry, phytic acid, hyaluronic acid, citric acid, vitamin E, retinol, apricot kernel oil. And it reduces skin repair and pigmentation by reducing oxidative stress. I believe everybody knows what antioxidants, their function are, but full of antioxidants. It's a beautiful program. And for cellular renewal, salicylic acid, mandelic acid, phytic acid, retinol, exfoliates damaged skin cells, promotes proliferation of a healthy non-pigmented skin. As you can see with those ingredients too, anybody that's prone to adult onset acne, in moments of clarity, if they have these treatments, it keeps their skin clear for a significantly longer time. And the mandelic acid and salicylic acid and phytic acid really, really do a wonderful job for people that are prone to post-traumatic hyperpigmentation from breakouts. The pigment in clinic, you're doing, it says here once a week for 7 consecutive weeks, and that was based upon their study. I would never probably do it that close together. I would do them about every 2 weeks. You can do them every even 3 weeks, as long providing that they're using their home care in between. The needle depth is at 0.2 in the forehead, maybe 0.3 in the forehead, as long as they don't have pinpointing, and maximum 0.5 depending on the area, and that would be on the cheek. So anywhere you see on your map that's shallow, I would be doing 0.2 or 0.3. Anywhere in your map, face map that you see deeper, you'll be doing about 0.5. It's probably the easiest treatment to ever do because you're not looking for any end. You're just basically infusing product is basically what it is. You always have your needle depth set at 150 strokes per second. Numbing is optional. Most of the times I'm just in a hurry. I disinfect their skin, and it feels kind of like the combination of a microdermabrasion with peel, to be honest with you, because the needles are so fast, they're shallow. It can feel a little tense in the forehead. So lots of times I'm pushing down on the headband just to thicken their forehead a little bit. Normally I'm pulling on microneedling, but because it's shallow, I'm not as concerned. I'm trying to just sort of fool the skin a little bit. You can numb them if they're sensitive. You gradually apply the content of the ampule to the area. If you have syringes, just break the ampule and syringe it out. I just find it easier to apply with syringes. I always use the derma roller mask on afterwards because their skin does feel like a sunburn after, and it really calms them down before they go. You can also use a Ready Medical product with growth factors, which is extraordinary beauty booster. And of course, you would charge an extra $100 to add the Ready Medical. Similar is like it'd be still less expensive than the PRP add-on, but you'd be adding your Ready Medical on to calm the skin and to create that, add that growth factors, because in reality, you're not going as deep to create the amount of significance for growth factors you would if you were doing a pinpoint bleed. So at home daily, in the morning, they can apply their bright lotion, use the dropper and apply the lotion in the area concern and massage it into the skin. And you can use it before your foundation. And you can combine it with the roller twice a week. If I'm doing the home roller, I'm doing it at night. So I cleanse the skin. I roll the skin gently. I'm holding this handle like it's a toothpick. And for more instructions, you can go onto our YouTube from Edermastamp and see how it's done. But you're just rolling your forehead in different directions. And then you do that for about 5 minutes and you apply your bright lotion. I do that at night when your skin is recuperating just before you go to bed, and you will have great results. And that's a nice example of pigment results. That would be even hard to get with IPL because how diffused it is and how scattered and bony the area is. So very, very nice results. I've seen nice results even after one treatment with this particular program. So now we are going, what's my time like? Wow, I have an hour. Okay. If anybody wants a bathroom break, we'll resume in at 11:20, if that's okay. Actually 11:18, because I don't want to, I only have an hour left, so, and I have a lot of stuff to still go through. Does anybody want a break? Does anybody need a break? If not, we can continue. Okay, everybody can just go and I'll meet you back here in 5 minutes, okay? And you can put your speakers on now that when people are gone for a break, I'm still going to be here. So if anybody has any questions, please feel free to ask.
Hi, Katie. I have a question.
Mm-hmm.
What about the client has a like suntan? Like it just came back from vacation or something.
You know what? If there's suntan like that, it's not pigment sensitive at all, but lots of times their skin is still sensitive, and this is a little bit more aggressive treatment. So I would still let their skin rest for a couple of weeks. I would never just like do a treatment from someone that just came back from a week, and I don't care what skin type, you know, that's just, and that's with almost any treatment. I wouldn't even want to give an oxygenale from someone that just came back that quick, you know, because everybody's had excessive tan and they're probably dehydrated and, you know, lots of people overindulge. So they're just, their skin isn't prepped properly. You need to have healthy, you know, fairly healthy skin to work properly with any of these results. Because I think, you know, they should give their bodies and their face a little bit of a break before they have any strong.
Okay, so I have a next question. Can we use this microneedling on body?
Absolutely. We do stretch marks all the time. We do scars all the time. Absolutely, you can use it on the body.
So how much depth we can go on the body?
When I've done quite a few stretch marks treatments, and I'm like doing it at 1. Honestly, the body responds quite differently than the face, but I just don't find that you need to have that 1.5, and it's quite irritating on the body too, because the body's a little bit more sensitive skin, believe it or not. So if I'm doing like a stretch mark, I've had really nice results just doing 1 millimeter. So I'm not even doing the big deep treatments that a lot of people think they would on body, and I've gotten really significant results with that. So I'm kind of the person that, you know, go in easy, and if you're getting good results, stay there. Like, why risk and go excessive? And then lots of times your clients, it burns, right? When you're on the body, it feels like a sunburn. So I'm selling the mask. Lots of times I'll have them just surround the mask on their area and go home like that, so they can put their clothes on if you're doing the treatments. Okay. And, so you do it very similar. You numb the skin. I don't do a huge area because I don't want to put numbing compound over that grade of area on the body because of toxicity issues. Right? So if I'm doing an abdomen, I'm just doing a smaller area. If I'm having to do like thighs, abdomen, everything else, I'll break those treatments into like 2 treatments. I don't want to be covering the body with numbing cream. So okay. Those are my concerns when I'm doing body. And
Mhm.
also, if I'm doing the entire body with microneedling,
Mhm.
where are they going to sleep at night? So I don't.
Uh-huh.
I usually like doing the front or doing the back. Like you have to sort of go client by client. But if they have
Mhm.
stretch marks on their stomach and they also have stretch marks in the back of their hips,
Mhm.
I would do the stomach one treatment and maybe 2 weeks later, because the treatments are done every 6 weeks anyway, right? So the
Mhm.
stomach one treatment and do the back of the hips maybe 2 weeks later. When
Mhm.
the stomach's quite recovered, and then 6 weeks later, I would do the stomach again and alternate them like that. Because
Okay.
that way, if I'm doing it around their back on their hips, they can sleep on their stomach, or they can sort of go on one of those roll pillows so they can get a little bit more comfortable. If you have them like if you have them treated everywhere, it's very hard for them to lie down and get good rest at night.
Mhm.
A lot of
So
people realize.
even on the body, we should look for the pinpoint to look for
Uh,
the
you
to
do
figure
get
out.
pinpointing, like you won't get pinpointing inside a stretch mark because there's no vascular network there,
Mhm.
right?
Mhm.
So
Mhm.
you're going to be seeing some pinpointing absolutely around the sides of the stretch marks. And
Mhm.
again, in most conditions that I've seen, and from younger to older skin, I've got pinpointing plenty, even at one.
Mhm.
Like it's just totally unnecessary to go deeper than that. And that is, I've had really nice results with that. So I'm not a fan of going really deep in the body, and
Mhm.
but it's a really nice treatment for that.
Mhm. Okay. So, how old is the youngest people we can treat with the
Typically, they're saying any professional treatments is supposed to be 18 and older.
18
Uh,
and older?
Yeah. So,
Mhm.
you know what? There's so many other issues, and even with compliance for product for home care, I wouldn't
Mhm.
trust a 15-year-old to look after their skin properly after microneedling, even if they needed it. So,
Mhm.
18 enough is usually, and then they can sign for themselves.
Mhm. Okay. So when we go to 1.5 millimeter deep, are we gonna see bleeding
Yeah,
usually?
yeah, absolutely. Almost
Mhm.
always. If someone had really thick, healthy skin, you wouldn't see pinpointing. But why would you go 1.5 on someone that has thick, healthy skin anyway? It's not necessary, right?
Mhm.
So
Mhm.
I'm rarely ever doing 1.5. I can do it, but that's usually like scar tissue revision on some gentleman that has cystic acne scars and it's on his cheek.
Mhm.
So
Mhm.
rarely do I ever go that deep. Rarely, rarely, rarely. I'm usually one. If I'm deeper on the cheek, it's one, maybe 1.2. Lots of times I'm doing the entire cheek at 0.8. That's still all in the reticular dermis, right? It's
Mhm.
layer, which is where the most damage is anyway. And the 1.5 really isn't necessary.
Mhm.
And like
Okay.
80% of your clients or more even.
Mhm. Okay. So how long we should stay on the one spot with the
You
microneedle?
don't. You just pass over it nicely and move
Yeah.
on to the other area. You know,
Okay. Let's say forehead. Forehead. How long we should do in the forehead and then go to
well, I'm
next.
sort of doing circles, and you'll see my demo. You started going circles and going across in parallel lines, back and forth, back and forth. You might do the whole entire forehead maybe 3 times, so that you just make sure that you have every area well covered. But I do not concentrate my treatments because that feels really uncomfortable for the client, and it doesn't give the skin time to respond, right? So you can go be really thorough, and then you move someplace else, and like 2 minutes later, all of a sudden that area is bleeding too much, right? You don't want to have that. And again, with atraumatic wounds, you're not even looking for a significant amount of blood. So just until everything's nice and pink, move on. You can always go back into that area afterwards as well, right?
Yeah. Okay.
So, you know, 3 times on any area, like back and forth, and not concentrating, nice big loops back and forth, you're fine.
Okay. Thank you.
Katie, I have a question.
Mm-hmm.
We have I don't know if you're familiar with the Solulite LED light.
Yeah.
So we usually use that before the treatment and after. When would you recommend we use it?
I wouldn't do it before because it's kind of a waste, but after you mask, they could go in then afterwards.
Right away, right?
Yeah.
Perfect.
You can't, obviously, I want the mask because they need the hydration, and the mask itself will block the LED, so it's kind of pointless. But once their mask is on for 20 minutes, you can remove the mask and let the LED sit there for 20 minutes.
Amazing. Okay. Thank you.
Any other questions?
Hi, Katie. I have a question.
Yeah.
So how far apart can we do microneedling after a laser hair removal session for the face?
You know what? That sort of depends upon Fitzpatrick as well, right? So normally like 10 days, it really depends. Like on my skin, I'm a Fitz too. I could probably do it 4 days later. It wouldn't freaking fizz me. But someone else with darker skin, you're going to have to be worried that, a lot of times people get irritated really quickly. And it depends on how aggressive the laser is. Right. So I really hate giving those numbers, but probably 10 days, 2 weeks, somewhere around there. That's probably a really conservative for some people, but I'd rather time something out properly than to get it too close together and be sorry. Right.
Okay. Thank you.
And that's providing it's not an aggressive one. If it was like something like Fraxel, like it'd be, or something like this, it's like a month, but anyway. Is everybody back? I think everybody's back. Okay, now we're going to be going into the hair and scalp treatment. This is a really exciting treatment. It's especially great during lockdown times because lots of times you can't do face with microneedling. So you can always do a hair growth, and you can always do body treatments with your microneedling, even if they're prohibiting facial treatments. And we've had really amazing results with the hair growth. Really, really happy with it. So I just posted one on Instagram. If you don't follow me, it's Katie Rietta at Edermastamp.com. And I posted, Katie Rietta on Instagram. But anyway, they have me, I posted a before and after of a gentleman recently with the treatments, and his hair is just amazing, beautiful before and after. So we've experienced some really great results. And it's super easy to provide. Okay, my computer is very great. There we go. So microneedling is an effective treatment for hair loss. These are all the clinical studies proving that it's very successful for even on dogs, apparently on Pomeranians here, but they've done a lot of studies on microneedling, and it does a beautiful job for hair loss, largely because of the VEGF and everything else we discussed about all the benefits you have on face. You have all the same benefits on the scalp, which helps with hair growth. So I think most people here, we're all professionals, we all understand the anagen and catagen stage a lot. When we're the anagen stage is when it's growing, the catagen stage is when it's transitioning, and telogen is when it's basically resting. So we can as the skin hair falls out, what happens is the anagen phase starts deteriorating and shortening. Normally for hair on your head, the anagen phase is 2 to 7 years. And that's why some people can grow incredibly long hair and some people can't, is because some people have an anagen phase, the growing phase is 7 years. So they can have 7 years of hair growth. So the hair is really long. The next person says, I can't grow my hair past my shoulders. It's just because their anagen phase is very short. What happens with a lot of people, especially gentlemen, their anagen phase starts diminishing, and so they can't grow hair at all. It's just coming up like fuzz, and then eventually it miniaturizes and doesn't come up at all. So this here is an example of types of scalp hair. We have the vellus hair, which is only 1 millimeter long. It's like fluff. And we have terminal hair that goes up to 3 feet long. And here you can see the example on this gentleman. So the hair loss clinical background, hair loss affects both men and women. In the United States and Canada, 60% of men and 40% of women are dealing with hair loss. The most common type of hair loss is called angiogenic alopecia, and it's better to treat at the early stages. The earlier, the better. And that's an example of male pattern baldness and female pattern baldness. And we can treat with microneedling both very successfully. So why do we lose hair? The hair loss is multifactorial. We lose hair due to natural aging of the scalp tissue, sun exposure, nutrient deficiencies, harmful chemicals used for styling, hairstyling, pollution, diet, nutrition, and more. However, the scientific community widely agrees that the number one factor is hereditary imbalance, hormonal activity in the hair follicle, meaning genes. Specifically to blame is pointed towards the one hormone called I needed some tea. Dihydrotestosterone, DHT. And you can see the percentage is significantly higher because of the hormone. So hair loss begins when the testosterone is converted to DHT by an enzyme called 5-alpha reductase. It's 5-AR in the dermal papillae. DHT then blocks the specific receptors in the follicle cells, which causes premature anagen to catagen transition and prevents the hair from growing to its full potential. The process continually shortens in the anagen phase of the hair cycle. It causes miniaturization of the follicle, leading to hair loss. And so you'll see it start to shrink away from the vascular network. And before you know it, it breaks off completely from the blood vessel and it dies. That's all there is to it. That follicle will never be revived, which is very, very sad for a lot of gentlemen. And you can see the difference in the hair as it's miniaturizing on the right. Healthy hair, monitoring miniaturization, and excessive miniaturization at the front. The good news is miniaturization can be reversed. The bad news is the eliminated follicles are not likely to be restored. So if you have somebody that's totally bald and they are out of luck, you have to have something there for us to work with. So what can we do about it? We can block DHT around the follicles. We can restore the activity of the dermal papillae. We can replenish microcirculation that brings oxygen, nutrients to the roots, and we supply nutrients, vitamins, and proteins required for follicle recovery and make sure the tissue around the follicle is healthy and functioning properly. Here we can see what I've already discussed about angiogenesis. Really important because what's causing the death of the follicle is lack of blood. So causing the VEGF with the angiogenesis is very important. And actually the microneedling and being able to infuse active ingredient, and that's why we're pretty adamant about your clients using rollers in between to make sure that that DHT blocker continues to get absorbed into the scalp and do its thing and to reduce the hormone. We end up with healthier looking skin and the hair follicles restored. The hair and scalp treatments combines 4 professional treatment and home care treatments. The kit contains 4 hair repair ampules, a robust complex of natural DHT blockers and pro-circulatory agents and cell activity boosters, 4 skin rejuvenation ampules, 5 mils each, rich with vitamins, antioxidants, amino acids necessary for healthy hair growth, 1 bottle of hair lotion, which they use at home, and then they continue to purchase this from retail. And it has a therapeutic complex of DHT blockers, antioxidants, and scalp rejuvenation agents. And these are our ingredients. We have ginseng extract, which anchors the roots of the hair follicles up to the scalp and blocks DHT. We have caffeine, which stimulates antioxidants, stimulates blood supply to the roots and blocks DHT. Saw pomelo berry extract is one of the most effective natural DHT blockers. And I want to stop there for a second. You go onto onto YouTube, you can Google saw pomelo berry extract, and you will see, like so many plastic surgeons, especially in La La Land, this is their newfound extract to use. Why? Because DHT not only affects our hair, but also causes aging in our skin. So actually saw pomelo is a very strong anti-aging ingredient for scalp and face, for everything. And it's one of our active ingredients that you're going to be needling into the skin, and it is going to really reverse aging on the skin. If you get some on your face, it's all good because it's fabulous for anti-aging on the face as well. Copper peptides, which most of us understand are very anti-aging as well. It's a DHT blocker, which again, you see this in skincare because of the DHT blocking factors, and it's in our microneedling home care because of the DHT blocker for our face. Promotes growth factors and it has a strong antioxidant. Biotin is the production of keratin and reinforces hair structure. B vitamin complex is the best vitamin group for hair loss. B Vitamins stimulate blood supply to the roots and increase keratinocytes activity. Amino acid complexes, building blocks of keratin and other proteins that supports healthy hair growth. Corn extract improves blood flow to the hair follicles. It's a natural emollient that moisturizes the scalp and hair by keeping the hair follicle hydrated and well nourished. Rosemary oil is essential oil known for its ability to improve cellular regeneration and blood circulation in the hair follicle. And they have done a study of rosemary oil on the NCBI site. I think we've included it in our slide presentation in the next slide, but it has been clinically proven to be as effective for hair growth as minoxidil, except it's not as irritating. So right there, the rosemary oil that's in our products is effective, because a lot of people ask, well, should they do the minoxidil? Well, rosemary oil actually is as effective for follicle stimulation as the minoxidil is. Sage oil, clary sage is essential oil that helps keep scalp oils and balance scalp oils and increases cellular metabolism. Vitamin C, a powerful antioxidant, which also helps create collagen and is an important part of hair structure. Hyaluronic acid enriches the scalp with moisture and keeps the follicles well hydrated. And grape oil, which is rich in vitamin E and linoleic acid, which helps hydrate the scalp and stimulate hair growth. So as you can see by our ingredients, we inundate the scalp with everything good that's going to block the hormone, cause VEGF, and feed and nourish the scalp. So again, a lot of people, well, would you use PRP with this? Well, PRP is a great stimulator for VEGF, but so is microneedling. But PRP is not going to have any kind of DHT blockers for it, nor is it going to nourish nor is it going to nourish the roots and the follicles the same way as this. So yes, you can work your PRP in and do a PRP for clients, because sometimes clients just want to get PRP. You can do PRP and then our treatments and then go back to PRP and use our home care, and you're going to get a nice result. Would it make a substantial difference? It's a big question mark, because again, you always need DHT. PRP, what it does is it causes VEGF and it causes the follicles to start growing, but the reality is it has nothing to do with the hormone block, so it'll start to miniaturize again if they're not taking some other kind of over-the-counter hair follicle stimulant, which you can take advantage of because they don't have to go to the drugstore and buy minoxidil. You're going to get something more natural for them, and they're going to be buying from you instead of shoppers. So 8 weekly sessions in clinic using the Edermastamp with fixed needles at about 0.5 millimeter and no numbing. You don't numb the scalp because you can't really do it. So how do you do the hair? You make sure they come in with fresh washed hair. I take a 70% alcohol and I sort of spray all the scalp out. I want the hair wet with alcohol for a couple of reasons. Number one, it makes the hair thin out because you don't have all this fluffy hair flying everywhere, and it makes the hair behave and look thinner. And it also, the scalp is incredibly full of bacteria. So I want to make sure that it's really nice and clean. So I'm spraying the area well with a 70% alcohol. I'm sort of wiping it so nothing's dripping or anything like that. I break the ampule, I apply a drop, and I start massaging it in working it in the scalp with 0.5 millimeter. Everybody asks me, well, do you do circles? Do you do lines? I do. Everybody's hair is different. Their quality is different. Somebody has curly hair, somebody has long hair, somebody has short hair. I probably do a different pattern on everybody's scalp. Lots of times if they're lying down on an angle, it's better. So it's not running in their face and I can sort of do their whole crown of their head really easy. It is an incredibly easy treatment to do. Just make sure the whole crown is covered. If you're doing circles, if you're doing lineal motions, I don't care, but just make sure the whole crown is covered and that whole entire ampule is infused. And that's going to take you about 10 to 15 minutes, and they're going to have a nice side effect. So make sure, I'd probably do even more. I'd probably do like a good 10 minutes to make sure that you get really nice microneedling coverage. The better coverage they get, the better growth they're going to have, the better response with VEGF, and the better infusion they're going to have. So make sure the whole crown is covered, and how many times, there is no how many times, probably 4 or 5 times I'm going to go the whole crown to make sure that everything's covered really nicely. I do not do it in segments. Some people want to do this and do it really thorough. That feels like a sewing machine on the head. So normally I start at the front, I work to the back, I go next, I go back and forth, right across the scalp. And then I'm working back and forth across the opposite way. And then you can go, you know, I just go back and forth like this, right across the scalp, back and forth until they're really nice and pink everywhere. And then that's it. And by then my ampule is gone. For you have two different ampules for hair growth. One is the hair repair ampule, and one's the skin rejuvenation vitamin ampule. So 1 week you're doing hair ampule, the next you're doing skin rejuvenation, the skin rejuvenation ampule. I'm probably doing the first couple of treatments once a week just to really instigate that DHT block and make sure that they bought a home roller from you and you're using your products at home. Other than that, like once it's past week 3, I'm usually doing the treatments probably every 2 to 3 weeks, depending upon how diligent they are with their home care. If they're really good with their home care, I would put the less treatments apart, because we've seen treatments done once a month and they have like friggin' amazing results. So as long as they're diligent with this, don't forget, this is a hormone issue. So this is something they're going to be looking at for a long period of time if they want to maintain healthy hair growth. So they're still going to have to come back to you in the future. This isn't permanent, right? We're always deteriorating. So if I can take that package of 8 and spread it over a longer period of time, and they're diligent with their home care, they're going to have beautiful hair for long term. It's going to make it easier for them to comply with this program, and they're going to be coming in. If they can, if eventually you're having them come in once a month for a hair treatment, it's almost like going to the hairdresser, right? Or once every 6 weeks, as long as they're with they're doing their home care and before, it's going to maintain that hair growth and their hair is going to be beautiful. So after the 8th treatment, they use the derma roller every other night, and they use the lotion applied every night. So they have to be on the home care pretty much forever, as long as they need to want to have nice hair. That's just the you know, they have hormone issues, and this is retarding that hormone. Note, there's a lot of doctors, etc., out there that have doing the insertions, of follicle insertions, and they use plugs. Those people, even though they spent thousands and thousands of dollars to have their hair done, guess what? DHT is still going to affect those follicles, and they're still going to shed if they don't maintain it. So one of your ads might say, if you've invested so much in your scalp and want to maintain that investment, come in for maintenance. So this is really good maintenance for anybody that's had hair follicle restoration treatments at the doctor's. So scalp versus PRP, DHT blocker, no. Vitamin nutrients, no. Angiogenesis, absolutely. With this, you have yes to everything. Ready Medical also does it. So if they wanted to do a one-off treatment, they can do the Ready Medical with growth factor. It's going to cost them a little bit more, and but you're not breaking up your entire package of hair growth. And that's as easy as the treatment is. The skin is washed, alcohol sanitized. You drop a few ampules, a few drops on, and you just work it into the scalp. It didn't show the application, but you're just basically, you can see sort of the hair is wet there, and they're just doing circles to work it in. And you can see here, they're doing circles in hair, and it's not tangling or anything. It's not a big deal. Easy peasy. I like to take this syringe out of my, take the syringe and take the product out, so I can just drop a hair, a dot here and there and work it in. This here is before and afters, and these are all our own clients. This is 6 weeks, after 6 weeks, after 6 weekly sessions. Beautiful. Very nice. After 6 weekly sessions. After 8 weekly sessions. This is after 5 treatments. This here after 6 treatments. Beautiful results. This is a client of ours. I think she's in Kitchener. That was her husband. After session 8. This gentleman here, that was 4 weeks after 1 treatment. He was one of the volunteers at our seminar I was at, and we asked for a model, and that was my colleague's trainer. So he volunteered unwillingly, and then he called us 4 weeks later asking to buy a package from somebody because he wanted to continue because he was shocked at what it did to his scalp. So beautiful treatments after 4 weeks after one treatment. Again, more before and afters. You can see the quality close up after 2 treatments. And that's why if someone, you can see here on the side, that's only 2 treatments. So if I can do the treatments a little bit further apart, I'll do that as long as they're good with their home care. Contraindications, and this is with microneedling in general. Never treat in the case of cardiac disease, largely because they're on a plethora of medications. Always have to ask their doctors if about any of the meds that they're on. Pregnancy, chemotherapy or radiation, skin cancer, Accutane, HIV. And consult your physician with blood thinners, hormone, HRT, lupus, any kind of collagen vascular diseases, bleeding disorders. Of course, I would never do that. That would be a contraindication for me. Uncontrolled diabetes, they're not going to heal properly. Keloiding, you're going to end up with scarring. Severe spider veins, erythema, or bruising in the area, you're going to have issues that either has to be healed or IPL'd first. Lactating or lidocaine sensitivity, you can do it without numbing. Active conditions. If someone was looking like this with rosacea, I would never touch them. You cannot go over anything that is elevated because, again, they have to have everything looked at by a doctor. Active rosacea on meds, eczema, psoriasis, dermatitis, bacterial, anything fungal, fresh sunburn. We sort of mentioned that. Recent chemical procedure. I even see some places and they're doing microneedling and adding a chemical product afterwards, chemical peel. I don't know what they're trying to accomplish, but if they understood microneedling, they would never do that. So that is something that's really against, I don't think there's a dermatologist on the planet that would be okay with that. Avoid treating directly on raised lesions, warts, hemangiomas, and tattoo, permanent makeup, because we're including microblading, because we're engaging the immune system, you can fade them. And no, it's not a tattoo remover because it's just going to fade them and make ugly. It's not going to remove them. Filler and Botox, avoid needling for 2 weeks. Possible side effects when done right. Microneedling is one of the less tolerated anti-aging treatments available. However, risks do exist. And I think I've probably covered a lot of this already. Infection, cellulitis, viral, bacterial, fungal infections can occur anytime the integrity of the skin is compromised. If they're doing microneedling and they want to use their own home skin and they're using something their Aunt Mildred bought them last Christmas, it's full of bacteria, good luck with them, because they're going to have like breakout all over their face and it's going to cause a lot of issues. They should always be using a fresh product. That's why we're saying use our product, because I'm not a chemist, so I have no idea what's in all of the actives and if it's going to compromise the treatment or not. Pigment change, failure to follow the post-treatment instructions can raise the risk for hyperpigmentation. Scratching, if they put on something and they get itchy and they start scratching, they're going to end up with hyperpigmentation. You must avoid excessive sun exposure for 1 to 2 weeks after microneedling. Do not apply sunscreen for 48 hours post-treatment. And after the skin has calmed down, you can put on the SPF and a facial moisturizer. And that's why I'm always saying the Cellular CC cream is both, because it's the ingredients are very collagen enhancing, plus it's a 30 SPF. Scarring, abnormal scarring may appear, especially if they're scratching or picking. Minimize the risk. Avoid picking and peeling the skin during heated healing process. Watch what they're putting on their skin. I don't want something from the shopping channel on their face. It is important to check that the client is not prone to keloid scarring, because thickening or keloiding could result. When done right, it's, hang on a second, it could feel slightly burning, scratching, irritated. It always feels like a sunburn. It's temporary and it's gone within a few hours. Sometimes on the body, it can last like until the next day, to be honest with you. Sudden appearance of redness or pain is a sign of infection, and they should notify the clinic immediately. Persistent reddening, itching, and swelling are normally signs of rarely persistent more than 24 hours. If you're doing the treatments less than 4 weeks apart, you can end up with prolonged symptoms. And that's why we're never saying if you're doing deeper in the skin, don't do it close together. Allergic response and granulomas. Microneedling increases the penetration of topical substance, therefore may cause hypersensitivity to product. Minimize the risk by using topicals made for microneedling, which is broken skin barrier. And no, just because your rep said it's okay, if they're not selling microneedling products, if it's not a sterile product and it's individually wrapped, don't put it on the skin. As simple as that. There's so many companies out there, and they're selling like they're selling like eye dropping products and pump products, which is air exposed like crazy, and they're using this for microneedling. And then we see, because we're derma roller, people contact us all the time, and they're not using our products, nor are they using our devices. I work with almost every dermatologist in Toronto. If you look them up on our site, almost like Dr. Kellett and everybody, they all have our products. And one of the reasons why they bought our devices for our products. And they get issues constantly from people that have gone microneedling gone bad because of allergic response and granulomas, which they can end up having to take steroids for a long period of time. You should Google microneedling granuloma and it will scare you. And you shouldn't, like, you know, people are just taking risks unwanted, and it's not necessary. Like, pay your $50 extra in product and use a proper product, and stop, you know, putting people at risk, as far as I'm concerned. This here is a gentleman who owns a clinic in London. He's one of our clients. That's 6 weeks. It's for a gentleman, 6 weeks after one treatment. Beautiful results, and he was done a very basic treatment. So we didn't have to, you know, have excessive blood. He didn't look like the Kim Kardashian shot, and he had this kind of response, and he's in his 50s. Beautiful, beautiful result. This here is 6 weeks after one Edermastamp treatment for discoloration, and she didn't have our pigment. That was just regular CIT. This here is one of my doctors downtown. This was one of her first clients for scar revision, one very basic treatment. And this was about 4 weeks after, 6 weeks after. I think this was taking at her second treatment, which was 6 weeks after one treatment. Beautiful result. This is a bad lighting picture, but it still shows some nice result for wrinkles. Again, bad lighting, but good result for wrinkles. This is somebody from Derma Roller. This is just showing ethnic skin with breakouts, and because of the cytokine enhancement and the normalization of sebaceous function, the client's skin looks amazing. Again, from Derma Roller. Again, from Derma Roller, really great for blemished skin. And that's just before very basic treatment. She was probably treated at 0.5. And this was just with the sterile hyaluronic acid. It wasn't even with our pigment treatment. That's just sterile hyaluronic acid, a mask, boom, hardly any blood, and beautiful result. So you don't have to go crazy to get a nice result, just be consistent. This is a 3-year-old hypertrophic scar, and that is 8 months after one session of derma roller microneedling. I think that is pretty amazing, considering that's a 3-year-old scar. Remember I was saying the derma roller started in a scar burn unit. This is some of their treatments that they were, this would have been done with a roller, by the way, which is a little bit different than the Edermastamp. This here was severe scarring with cigarettes from Russia 2 months after a treatment. Beautiful results. Don't ask me why I had burn marks like that. Before and after one session of microneedling, and that was an old scar as well, several years old. So you can see the founding scars and scar revisions these were like older shots, and beautiful results from burns. This here was from India. Again, very basic treatment, not particularly aggressive, beautiful result for scarring and clearing the skin. This here, I love this shot because it's 6 weeks after just using our home roller, and we have like pumped hyaluronic acid and our vitamin A, C, and E, and that was beautiful results. They didn't even come in professional treatment. They were just buying our home care. So really, really nice, 6 weeks using our products. And that is it. Now, where am I going to go here? Stop share. I want to I think I have my, here, I just wanted to show you this. I'm going to send everybody this anyway. So I have a treatment. Can everybody see that?
Can see it, yes.
You see the Edermastamp treatment overview. So I have this, I'll send to everybody. It's just sort of like a, you know, a cheat sheet on how to do the treatment. First, you disinfect the working area with Virox or any medical solutions. You ensure that there is a 70% alcohol spray available. You use a plastic wrap to cover the device and cord cover. You get the cord cover from us. You apply the cord cover. You can use, I normally use a Virox wipe over the plastic cover for added safety. You clean the skin and cover the area with Zanza or 5% lidocaine product, and you cover thickly the upper lip and forehead. You do not use a compound because that's vasculoconstrictive. If you use a compound from the doctor, you're going to end up doing microneedling and they will be white as a ghost because there's no blood there because it's vasculoconstrictive, and I've seen that lots of times. So just don't. Just use a light 5%. It's not that uncomfortable anyway. It's more than enough. You wait 20 minutes before the numbing takes place, and you just wipe it off, wash the skin with our cleanser, and make sure it's well washed off because I don't want any residual numbing compound on it. Then you are going to use a 70%, and you are going to wipe the face very thoroughly. It smells bad. I feel sorry for your clients. It smells, but it's necessary. You have to clean it with 70% alcohol. Then when you start the treatment, you're going to apply a small percentage. You're just going to take the tip off your syringe, suck in some air, which is important because you need that vacuum to release, and just put a little blop on the forehead, and you're going to start the machine. You're going to start at about 0.3, and you're going to do a few circles and just wait wait a minute to see if they pinpoint. If they don't pinpoint, you go up against 0.1. And again, all of this is going to be in the video shown to you. And you'll go a couple more circles and see if they pinpoint. Lots of times I'm around 0.5. I probably wouldn't even go more than 0.5 on the forehead, to be honest with you, because that's a significant depth. So forehead, and then you go and do the forehead, nice big circles back and forth, linear pattern until it's covered, probably going back and forth about 3 times. If they're not particularly pink, because sometimes people just recover really easy, you can do a 4th, it's not a problem. Forehead and nose and under brow, it says brown there, that's a mistake. Start at 0.3 and work up way in intervals in 0.1, okay, until pinpoint bleeding occurs. Temples are usually 1. You can look at your map. It's usually 1.2 more than the forehead. Upper lip is usually probably the same. Cheek and thicker area, you can start at 0.7 and work up in increments of 0.1. Lots of times on the cheek, I'm doing anywhere between 0.8 and 1 millimeter. So it's very, very easy to provide the treatment after the entire face is treated and pinpoint or redness is everywhere you want to treat. Continuing to blend, you just turn the foot switch off, and any bleeding that took place, you blend it in with the lubricant so you don't see any blood spots. Everything just looks nice and pink. You turn the you use the hand tip. I don't want to see people massaging someone's face with your hands. That's how cross-contamination happens. It's important to maintain the integrity of your workspace. Everything should be sanitized. I have alcohol and Excel wipes beside me. If I accidentally touch anything that's except my client, I'm sanitizing my hands again. I'm keeping everything clean through the whole treatment. And I do not touch anything that I perforated with my hands. During the treatment too, it's very important to keep areas of the skin dry. I don't slather hyaluron all over the skin because it's totally waste of hyaluronic acid and just makes them messy and tacky to work. Just do a drop and work it in, and then when you're done that area, put another drop down. Don't slather it everywhere. I see people using the tip to paint their face with hyaluron. Just a waste of your time and waste of it's just making everything tacky. And a lot of that's going to evaporate before you get to the area. So just leave it in the syringe until you need it, and just a drop at a time. In thicker areas, pinpoint bleeding may not necessarily present as we're making atraumatic wounds, and the puncture simply closes on itself. So you don't have a lot of bleeding like on the cheeks sometimes. And when done, mask the client. You remove the blue sheet and use either the blue section, either for neck or home use. The blue is often discarded, but to me, it's full of beautiful liquid, so I don't. I use it. You paint the white silk mask side on the face, and there's a plastic cover. After you sort of apply it, then take the plastic cover off because the silk is very fine, so you will make a mess if you take the plastic off first. So I do it that way, and then I just keep this. I make sure that the silk is sort of air-free and fully engaged on the skin, and I let them rest like that for 20 minutes. The skin calms down and has a dewy look from it. Do not touch or wipe the skin, and just let it heal and absorb. Do not put on sunscreen. It'll be a couple of days before they can use sunscreen. Sun avoidance is best, hat and sunglasses. It's recommended that they use just hyaluronic acid for 24 to 48 hours after, and then apply the home care. After the treatment is to ensure the client leaves with their home care cleanser, moisturizer, and the lipopeptide if it's for anti-aging. Following morning, apply following the morning, this is the morning after. This is written in wrong. I'm going to correct it. I'm just proofing it. This was written a long time ago. The following morning, after the 48 hours, you apply the moisturizer and apply often as needed. At night, before bed, you can apply the lipopeptide, and you should be using the products liberally for post-care in between treatments, and treatments are done in intervals. So here, it's after the 48 hours in the morning, you're going to be applying. There's a little miscommunique there. So just make sure you're not applying that immediately after. It's 48 hours after. The client should keep the skin clean and moisturized, and refrain from exercise or sauna until the skin is calmed down, which can be several days. And a mineral SPF or Cellular's product can be used the following day after our 48-hour recovery time. So I'm going to change a few articles on that and then give you a copy, so you have a copy of what's going on, of what to do. Now, I also want to go over the Ready Medical. Oh, not that one. This here, if you go on to our, I'm not sure if you are aware of this, but we have on Google Apps an app called Edermastamp Store. And when you log on to that, you can see all of our products for microneedling there, and that's where you should be ordering, etc. So just to show you, this is all the different products that we carry for microneedling, and we've already discussed most of them, the needles, the CITIL, the hair, scalp, the pigment correction, hyaluronic acid. And here are all of the other products that you might be using. The home care roller and cleaner, very important to be ordering that for your clients for resale, because anybody that's having a microneedling program, they should be using that. The moisturizer ACNE, very important product to for moisturizing the skin after their 48 hours. You can also order the hyaluronic acid dispenser, which goes really nice with the home roller. That is very affordable. Your retail would be $75 for that, and it is a fabulous way of infusing hyaluronic acid into the tissue post treatment. And as an aged person, anybody after 50, you've lost about 75% of your hyaluronic acid. So it's very important to be infusing the hyaluron into the skin for home care. And hyaluronic acid is a huge molecule, so it doesn't absorb naturally. Because it just sort of sits in the top of the skin. So by home rolling it, they'll actually get that infusion. We have these ampules, and that's normally what we suggest. You give a couple of ampules for that 48-hour post-care program. We have they'd have the treatment, you give them the leftover of their mask, and they're going to using the hyaluronic ampules after that. The lipopeptide with vitamin A, that would be for anti-aging. That would be using as for night for anybody that's a smoker or anybody that wants anti-wrinkle. On the cleanser, of course, they're using that during the whole process. The Hyaluron C is a wonderful, also goes with the home roller. They can order that and infuse the skin, hyaluronic acid and vitamin C, which is very strong antioxidant. Someone that's smoker or excessive tanning, they would do very well to infuse that. And all of these products, because they have less preservative, they have a diaphragm in them. These products, especially the serums, are only good for 3 months, so they have to use them. They can't hang on to them. You open them up, they're going to use them with 3 months after opening, and they have to get rid of the program. This bright lotion is what they use for discoloration, and the hair growth lotion, you're going to be buying that for maintenance for people that have had those treatments. The Beauty Mouse is a device that people can use for body if they're coming in for body like correction of any kind, for stretch marks, etc. They can use the Body Mouse and use any of our products, especially the ACNE as a body moisturizer to really help instill new collagen for their arms, their thighs, wherever their skin has been compromised. Of course, you have roller cleaner there that helps to get rid of and keep your skin really nice, and your roller's really nice and clean. Here, I'm going to try to find that other presentation. Which doesn't seem to be wanting to. Ugh. My apologies, ladies. Well, I guess I'll have to use the old one. I'm going to share with you the Ready Medical, there is 4 lines. This one's only showing the first line, one of the products, but it is the most common product, so that's why I'm going to go over it with you. Can everybody see that?
Yes, we can see it.
Okay, so the Ready Medical is a sterile product that we use. It's 2 syringes, and one is micronized hyaluronic acid, and the other one is with growth factors. And so I just wanted to go over that a little bit because it is a really nice add-on to your microneedling. One of the ingredients, of course, is copper tripeptide, which is an ingredient that goes through our whole Accelerus line. The copper tripeptide is a molecular structure of copper tripeptide. It's indicated by its name. It's a tripeptide chain, and it is a compound. It's great interest to aesthetics. It really helps to increase collagen synthesis, and it affects the DNA repair. So it is quietens excess inflammatory process. It's a strong antioxidant. It really improves post-procedure results. So in this, we have the copper tripeptide. We also have that in our Accelerus program, and that is why we especially for anti-aging, have that long-term skincare to be with anybody with an anti-aging program. Also helps with wound healing, helps with tissue remodeling and skin renewal. It is an acidic fibroblast growth factor that modulates the skin rejuvenation by stimulating the cell proliferation. It strengthens skin elasticity, and inducing the synthesis of the collagen elastin, has healing and wound repair properties. We also have the CGGF, which is another growth factor. It helps reduce and prevent lines and wrinkles by actively generating new skin cells. It refines texture, glides effectively on the skin. It protects the keratinocytes from UV cell damage. We have the ogulopeptide 2. It's an insulin-like growth factor that modulates the skin rejuvenation and stimulating the cell proliferation. It reduces and prevents lines and wrinkles, and actively generates new skin cells. It increases collagen elastin levels, reduces blotchiness, it refines texture, glides effectively, and slims your face and body with a fat burning effect, which is awesome. The polypeptide 1 is a basic growth factor. It reduces and prevents lines and wrinkles by actively generating new skin cells. It helps normalize skin growth, healing and repairing wounds. It strengthens elasticity by inducing synthesis in collagen elastin. And then, of course, you have your ogulopeptide, which is epithelial growth factor, CGF, that reduces and prevents lines and wrinkles by actively generating new cells, enhances tone for the skin, brimming with vitality and energy, neutralizes the skin, and it leaves smoother, brighter, and regains youthful look. It eliminates scars by producing new collagen type 1. So that is, it also has TGFB3, which is the main ingredient that has that is for collagen type 1. So a lot of times where our fibroblasts have already gone dormant, so we're not going to be producing the growth factors necessary to cause skin remodeling. So it's an excellent add-on to anybody that's aged skin or is healing impaired. Then we have the PFDPA, which is another totally different type of syringe, and it is vegetable oriented active ingredient. What it does 2 things. It helps heal by, it absorbs oxygen and binds the oxygen to the wounds. So it really, it's a really strong, effective way of helping to heal the skin, and it is considered to be one of the most effective anti-aging ingredients, as it remarkably improves skin moisturizer. One of the reasons why they use this is if you're having something cute like a Q-switch laser, or you're doing tattoo removal, it rapidly helps heal. So if you had any kind of treatment that went wrong, someone has some kind of wound on their skin. We had somebody that had a burn on their forehead from a curling iron, for instance, they put on the PFDPA and it helped heal the skin. And there's tons of studies at about 50% of the time. So if something is gone amiss, this is having a syringe of the PFDPA by Ready Medical is sort of like having an insurance policy. So really, really makes a big difference. The hyaluronic acid syringe, this is in all their different products. It is a preservative-free, fractionated with ultrasound sonicator. So it has low, medium, and high widths, molecular weights. And it is very, like, because it has a variety of weights, it's improved as skin permeation. There's a lot of people saying, well, you can only use a high molecular compound when you're doing microneedling, and that's simply not the case. High molecular weighted hyaluronic acid is just really super cheap. You buy powder, you put some water in it, and you have high molecular weight. So they're coming up with a study that sort of like, you know, justifies the fact that they're using less treated hyaluronic acid. But the reality is a high molecular weight product is about 2 million Daltons, which is massive. It's never going to penetrate your skin. It's going to sit on like a barrier, and it's never actually going to have the nice hyaluronic acid effect that we're wanting. So that's why they have something that's a small, medium, and large. The smaller can penetrate deeper. Medium is going to be a product a carrier, and the large is going to be like a barrier on the tissue. So it is used for very invasive treatments or injured skin. So they can do it on anything because it's there's no preservatives, it's sterile. So we also have a hyaluronic vitamin C, which has the same type of hyaluron, and it has a vitamin C that's very comparable to the skin. So it's a very strong antioxidant, and you can use the Ready Medical products for any kind of microneedling if they want a one-off, or if they want a beauty booster. If they have breakouts, we have a product for Ready Medical that annihilates P. acne bacteria. So if someone's coming in and they have acne scars, but they still have some residual breakout and infection on the skin, you can do the Ready Medical for acne and do work that into the tissue, very conservative, and where you cannot microneedle, you can't go over infection, but you can put the Ready Medical, which is going to annihilate the bacteria in that area. And then when they come in a few weeks for their next treatment, you're probably going to be doing a more shallow treatment on that person. When they come in for their next treatment, that area is going to be disinfected, so you'll be able to do the treatment over it. It's going to help with the wound repair. And not only does it kill the bacteria during the treatment, but it leaves a residual microbial effect that's going to keep the skin bacteria free for a minimum of 24 hours. They did some studies at 24 to 48 hours. So it's not just like I'm cleaning the skin for 5 minutes and then in half an hour there's going to be a bacteria there again. It's giving the skin time to actually heal and keep that bacteria out of the area for at least a day to 2 days to longer. So it's a very, very nice treatment for anybody that has issues with breakouts. Okay, so that is pretty much it for the treatment. I just wanted to do a Q&A because we do have a few more minutes left, and I just want to ask anybody that if they have any questions at all, if they can